Drastically rising COVID-19 cases tonight, severe nursing shortages and limited resources. It's the making of a dire situation facing health systems across the United States and here in our area. This weekend, Ballad Health shared a, quote, urgent message from its CEO, Alan Levine, who said COVID-19 hospitalizations have more than quadrupled since July 4th, with some children in intensive care units for pediatric care. He says that increased strain means emergency department delays are, quote, highly likely. News Channel 11's Ansley Daniel spoke with Alan Levine today about our region's current COVID-19 situation and what he believes this means for patients. Ansley?
Josh, Levine told me that the system's 3 main tertiary hospitals are in high demand right now, and they are all dealing with a nursing shortage. He says that surge plans are now being refreshed, and Holston Valley, Bristol Regional, and Johnson City Medical Centers are getting ready to open COVID wards once again.
When you look at our bed holds and you look at the surgeries and you look at how many COVID patients, which are incremental visits, how much can you handle? We're above that number right now.
After an alarming increase in COVID-19 cases as the Delta variant spreads much quicker, Ballad Health leaders are preparing for another surge.
COVID patients require a lot more resources. So when you start moving nurses from regular med surg over to the COVID units, it's not a one-to-one. Unless we have more nurses, it means that some other part of the hospital has fewer resources.
The national nursing shortage also hitting the regional system, creating longer wait times in the emergency departments.
If you don't have enough nurses, then what happens is you staff at those ratios and you try not to stretch them out too much. And once they get to a point where they feel it would be unsafe to take more patients, we stop taking patients on that floor. That's why the emergency rooms get backed up.
CEO Alan Levine assures that those with the most life-threatening and serious issues will receive care in the ER first, but they are preparing for the situation to worsen.
We're obviously watching it very closely, and we're consulting with physician leaders throughout the system to determine, at what point would we have to start looking at perhaps curtailing some of the elective surgeries. And what that does is it frees up staff and it frees up beds.
Levine told me that 95% of the COVID patients in the hospitals throughout the system are either not vaccinated or only partially vaccinated. He says he's concerned that the region has hit a plateau with vaccine numbers, and he says that he hopes more people will go get the vaccine to make the situation a little better. Live in Johnson City, Ansley Daniel, News Channel 11.
All right, Ansley, thank you. Alan Levine says as of yesterday, Ballad Health had more than 100 inpatient COVID-19 care recipients with the virus. The health system says 4 of those COVID patients are children, and he said 3 of them are in the pediatric intensive care unit.